Hello, everyone. My name is Travis McKay. I am the creator of Sensor. I am the host of the podcast, author of the blog, creative director, editor, audio engineer. You get the point. Sensor is something I created in early 2020, but the origin story is coming later in the episode. First and foremost, I want to welcome you to the show if you're new here. There are two things I want to make clear about this podcast. One, my main goal is to educate all my listeners. If you find the show entertaining, that's a byproduct, and of course, that's what keeps it fun for me. If you saw how much I laugh when I write blog posts or record these episodes, you would think I'm crazy. Nonetheless, the other thing, point two, that I want to make clear is that if you become a regular of my podcast, I'm really here to teach about healthcare technology, biosensors and other diagnostics, related biomedical and engineering research, and all that jazz. I'm in the field. I do this research in pursuit of my PhD. I can sift through the jargon and make things clear for you all, which is what I strive to do. Back in school, we had teachers, and these teachers didn't call in substitutes to teach the material every day. So while I would love to have guests on the show when it gets situated a bit, I wouldn't call Sensor that type of podcast, but maybe one day or in a later season. Anywho, the way that the world is advancing today, everybody is developing ways to provide more information about our health so that we can live more empowered lives, more deliberate lives, more proactive lives, taking our health into our own hands. The healthcare landscape is complicated, and a lot of people that make these technologies make a lot of money, start a lot of companies, publish a lot of papers, but they don't really emphasize educating their consumers, patients, or the general population about their health or the science that goes into their technology. I'll be honest, we are sort of in a wild, wild west, but in an effort to transition towards value-based and proactive care measures, educating people seems like the first step to accomplish anything to push someone to the side of healthy behaviors. Not selling them a product, not convincing them of metrics and algorithms, but education in words that people understand. So with that being said, welcome to Sensor. I congratulate you for finding this podcast and embarking on this fun journey with me. Take off your jacket, stay a while, and once again, glad to have you here. Without further ado, this is episode 0, just to introduce you to the show, who I am, and more of my overall vision with this endeavor. Let's get to it. An exploration of sensors that empower humans. Sensor. 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 If you are feeling that intro, let me know. For the transitions, sprinkled a little bit of Full Metal Alchemist on that. But anyway, like I said, this is Sensor. My name is Travis, and I'm your host. Just a little bit about me. I'm pursuing my PhD in biomedical engineering at North Carolina State University. Wolfpack Nation stand up. And I do a lot of work on developing biosensors and transitioning them into applications related to bioprocessing and biomanufacturing, or healthcare technology and distributed diagnostics. I did chemical engineering in undergrad. I like to eat and cook. I play a lot of sports. Big fan of sleeping and hanging with family and friends. I love competition, and I can't say no to a healthy challenge. On my website, I refer to myself as a researcher and healthcare technology enthusiast, and I think that's an accurate description of me in a professional sense, at least. A question I get a lot is, why grad school? I wanted to go to graduate school to learn how to make biosensors. Simply put, that drive really came from an internship I had in 2018 where we were developing a wearable monitor that collected your sweat and told you information about your health. The sheer amount of information we could gather in a small sweat sample was fascinating to me from these different biochemicals or analytes in our sweat. Glucose is a big one for managing diabetes. Lactate is another analyte that's a measure of physical exertion. We work out, we feel sore. That's the lactic acid in our muscles. That's something we can measure, and there's interest in that from the athletic realm and understanding physical performance of their athletes and understanding muscle recovery. Another analyte, cortisol, can be used to determine how stressed a person is, and there was interest in that from the Air Force in monitoring fighter pilots during their training programs to see how they respond in stressful situations. The list doesn't end, and sweat isn't the only thing we can juice information out of. Our saliva, urine, tears, semen, interstitial fluid, blood, heart rate, breathing pattern. These are all places or facets of our bodies we can use to understand things about our health. And the crazy thing is this: for any disease, health condition, or ailment, that corresponds to a mix of chemicals, molecules, or compound changes in our bodies that can actually be detected. So in essence, our body is speaking a language. We just don't have the tools to understand what our body is saying. And that is why I took on biomedical engineering, because we actually make those tools to translate the language of our bodies into words we can understand so that we can be healthier if we choose to be. So that's my goal with my graduate training: learn how to make biosensors. So down the line, when there's a call for a specific disease or health condition that piques my interest, I'll have all the skills to develop an impactful solution. With that, I'm definitely interested in entrepreneurship and the startup space, because it's really cool to see people create some of these devices from scratch and understand how they came about their problems and why they found it important to address that specific gap in healthcare. I'm also a big fan of outreach, which you can probably tell from the fact that I have a blog, but a lot of these healthcare issues remain issues because it takes people that care about those issues. I didn't know what biomedical engineering was until college, and biomedical engineering meant something completely different today compared to 5 years ago, and meant something completely different from that 10 years ago. So by educating people and informing people about such a rewarding and exciting field way earlier in, say, middle and high school, I believe more people would want to enter the field and solve cool problems that mean something to them and the people around them. For example, cholesterol is a big problem in the Black community. So right now, I am creating a standalone cholesterol monitoring device that can be used to evaluate someone's lipid panel outside of the doctor's office. I am also working on a diagnostic device that tracks levels of specific lipids in mice to track how those change as a tumor is growing, and that would be for early cancer detection. The cool thing is that the same technology can also be translated for pharmaceutical manufacturing. If you don't know, aside from clinical trials, the reason why drugs cost so much can also be attributed to manufacturing inefficiencies. So these biosensors that we're creating can be used to better production processes, as well as make conducting clinical trials easier, recouping some of those costs. There's a lot going on, a lot I'm involved in. So at any time, feel free to reach out and ask about what I do regarding biomedical engineering, graduate school, blogging, this podcast, anything, and I'd be happy to answer. Science is really all about new ideas and helping society. We all have different experiences and have something unique to contribute and learn from one another. So with Sensor and my career path, I'm doing just that. With regard to the healthcare technology landscape as it stands, it's understood that continuous monitoring of different analytes or biomarkers is helpful in managing any aspect of health. We all see the Apple Watches, the glucose monitors, and even routine coronavirus testing. My biggest fear is that with this pandemic, everyone really started caring about monitoring their health, but what happens after the pandemic? There is a huge influx of fitness monitoring devices and politics and basically a bunch of nonsense that we may confuse patients and consumers and let go of this huge opportunity to continue this heightened stewardship of our health. The future of the field is portable monitoring or diagnostic testing from your home, and that can only be enabled by new innovations that lower cost, increase reliability, are convenient, and user-friendly. That's where the Wild Wild West idea comes into play, and that's why I highly recommend getting into this field. There's a lot of health concerns that could benefit from new technology, and I feel like I see a new diagnostic company closing a seed funding round every other day. Anyway, this is the field I'm getting into, and you'll learn a lot more by staying tuned to my podcast and social media profiles. But I hope that gave you a nice little introduction to what I do, because I get that question a lot. So that's my answer. Sensor. We're going to switch gears, and I'm going to talk about why I started a blog. Back in 2020, early quarantine days, myself and probably a lot of us were going crazy, being stuck at home for an extended time with nothing to do. As a first-year PhD student back then, I was still trying to figure things out, and that break from research was really unproductive. There was also a lot of social injustices going on, especially with George Floyd, and when you see those things, it really makes you feel helpless. Then you start to realize that a lot of the things in this world are bigger than yourself, and there was only so much sitting on my couch that I could do. And I really started to think of ways that I can provide value to the world and be of some use to make an impact with what I know and what I was willing to do. Kobe's death also made me feel a certain way because the world as we know it can change out of nowhere, so we all should use the time we have to make the world and the people around us better. My expertise in engineering and biomedical applications made the most sense. Why not devote time and energy outside the lab to help people understand why I find my field so cool? Not only that, but healthcare is a complex landscape, so many people simply don't understand what their doctors are telling them. And there is a lot of misinformation about products on the market, what results of different blood tests mean, why people rely on medications in the first place, and what lifestyle factors can be monitored to be healthier, and so on. People are generally just misinformed, and that can have dire impacts down the line if that influences how they manage their health present day. That was part of why I started a blog, to help people understand healthcare technology, but the other part was to help myself understand healthcare technology. To become a master of the field, you first have to be a student, so I was using this blog as an outlet to actively research the cool things going on so that I can learn and figure out gaps where I can fit into the mix. The blog sort of became its own thing, and I really enjoyed talking about different ideas, discussing them with friends, family, and colleagues, and really being a source for interested students and future scientists who want to know more about my field because that's their interest. The name of the blog, Sensor Sensor, comes from a play on words from my favorite anime of all time, Hunter x Hunter. I won't spoil the show, but to become a hunter in a sense was like choosing a specialty, and you would go on your own individualized journey with vastly different motivations. But the idea was that you were enabled to explore a certain path. I really like the show, and if you've never seen anime, I haven't met a person that doesn't like Hunter x Hunter, but with Sensor Sensor, I'm doing an exploration of sensors that empower humans. That is my specialty. I want to enlighten everyone about cool healthcare technology. I'm going to lab every day to learn how to make these things myself so that I can have a direct impact on the world, on people bettering their health, choosing healthier behaviors, and becoming more literate in the healthcare space. You'll probably see a lot of anime themes in how I express my content, like the Full Metal Alchemist transitions or the name of the blog, the pictures that I post online, and maybe even some of the merch. But my advice to anyone is to combine your passions and be as authentic as possible. Now, there was a period of time where I went months without posting to my blog, and honestly, it was because I got bored of writing. There were a lot of demands with my research because things weren't quite working in lab, so I had to prioritize, and the boredom made it really easy to put the blog on the back burner. I'm not sure where my newfound motivation came from, but I definitely have to thank all of my friends, family, and colleagues who happened to read my blog and really support the endeavor. Whether it was from buying and wearing my shirts, to having conversations about my blog, to giving me ideas about what to do with the platform and making me think big picture and the impact, because I do tend to belittle my efforts from time to time. So for my early Sensor Sensor supporters, I'm really only backing up at it again because of you. So if that's you, you can always reach out and free shirt on me. The funny thing about taking that break from Sensor Sensor is that that's exactly what the creator of Hunter x Hunter is doing right now. It is a great anime and it stops at a really good point in the story, but the story is not over and the creator is really taking his time. I have every intention on maintaining a consistent schedule. Right now, I'm thinking first and third Tuesdays for the podcast and writing my blog posts as they come. But my main priority is quality. If I have to take a year before I can drop another quality episode, then I'll take a year, but I don't expect that. 2 episodes a month should be manageable, and I'm thinking 20 to 25 minute episodes. That's about the time of one episode of a TV show, which everyone has time for, so I'm going to stick with that for now. If there's any comments or suggestions about format or anything I'm doing with the structure of the show, please reach out. I'd love to hear it. I'm here to learn, and I'm here to deliver this material in a way that's most tasteful for the most people. Sensor Sensor. Sensor Sensor. So like I said before, the blog took on a life of its own. Now it's a blog and a podcast, and I'm eager to see where it goes from here. A lot of people ask me about the shirts, so I'll definitely make sure to plug everyone when that's ready, probably once I get a little more content out. I'm excited. I hope you're excited. Subscribe to the blog to get notified whenever I post. We're on Spotify, YouTube, the RSS feed is on my website, Google Podcasts, Apple Podcasts, SoundCloud, you name it. Follow me on Twitter and Instagram. You can find all these avenues on the website, sensorxsensor.com, and let me know what you think about this episode. I'm going to close out, so I'll drop a quick recap. This is the podcast you want to listen to if you want to learn about healthcare technology, biosensors, and the ways we're using those to manage different health conditions and to live a healthy lifestyle. I gave you a little background about me and why I care about biomedical engineering, why I'm in grad school, and why I started the blog and now this podcast. With that, be on the lookout for episode 1 coming later this month. And until then, you have plenty of time to at least watch the first 3 episodes of Hunter x Hunter. My name is Travis, I'm your host, and this is Sensor Sensor.